Hi, my name is Dr. Avanti. I'm a GP at the Village Surgery in Thurcroft, and that's in Rotherham. So today I'm here to answer any questions and talk to you about winter illness. Now, my expertise in winter illness is all based on 18 years of looking after my patients through winter and treating them and supporting them. So today we're going to, it's a question and answer session. So while the questions start coming in, we'll kind of look at why winter illness is common at this time of year, especially as you can guess, it's the weather, it's cold, people are in closed environments, and viruses spread easily in close-knit communities. So as part of looking at winter illness, we'll talk about winter illness in adults and winter illness in children. And where, if you do have any symptoms, where you can get some help and advice. Now, the flu season this year started earlier than expected, as we all know, because everybody's been talking about it. Now, you would have also seen in the news that the hospital beds have been quite full and hospitals have been very busy with flu. Statistics are showing about 50% higher occupancy rates of hospital beds with flu cases in children and adults. And this has been made worse by the expected norovirus and RSV infections as well. Now, flu is a virus, as we know. So from that, we understand that it is what you call self-limiting. So what happens with a self-limiting illness is a healthy individual will catch that bug. Your body's immune system fights it and it gets better. You get better within a few days, normally expected to get better within 5 to 7 days with what we call supportive treatment, paracetamol, ibuprofen, if you can take it, lots of fluid and rest. But sometimes your body needs a bit of help to get better from certain illnesses. If one has predisposing medical conditions like lung conditions, you might have heard of conditions like asthma, COPD, heart conditions. Sometimes children are born with certain heart conditions, or adults have heart attacks and conditions called atrial fibrillation, where your heartbeat beats irregularly. So in opportunities like this, you need to be a little bit more careful and seek medical advice a bit sooner if you tend to get the seasonal flu bug. And help can be sought yourself on, by going to your local pharmacy or even contacting 111 or your GP surgery. And then if you are really unwell, you may even think about going to A&E. Now, when you contact your GP surgery, there are different ways you can get advice or contact a GP. Some surgeries have a texting system where you can text your symptoms through, and an appropriate healthcare professional will contact you back to have a conversation either via text, telephone, or invite you to come and see them face to face. Now, going back to the common illnesses that we get during the winter season, the common cold is something that is very, very common and seen amongst most of us. And then we get the flu-like illnesses that we all know so well. COVID is still around, and that is also still spreading, even though to a much lower grade than it did in the pandemic. Norovirus is also prevalent in the winter, as are chest infections, and these all can be viral or bacterial. Now, I'm waiting for some questions to come through if you wanted to talk about any specific symptoms or illnesses that I've just mentioned, if you wanted to go through any of those. I'd like to talk a little bit about the flu vaccination and why that is important, because it is imperative that we try and get as many people vaccinated during flu season. Now, the flu vaccine doesn't stop one from getting flu. So I have patients that tell me, I'm not going to have the flu vaccination because it gave me flu last year. And that's a myth. It is just that the flu vaccination is kind of born of the previous year's flu bugs. The World Health Organization does a global data collection activity to look at what the following year's flu vaccination should encompass. And then the information is shared with each country. And so, for example, in England, there are 100 plus laboratories that collect the data, share it with the World Health Organization, who then comes up with the basic formation of the vaccination that then the UK will work further on to make it equivalent use for our population. So the vaccination changes every year, and we need to change the vaccination because the flu virus evolves every year and it changes slightly. And this is why the vaccination is not 100% because it's based on the historic information from the previous flu season. And even when we are in the flu season, the virus evolves, as we find it has done this year, causing more people to be more severely ill and making it look to the general population that the flu vaccination program hasn't been that successful this year. So as a healthcare professional population, we can't predict exactly how well the flu vaccination is going to do, but we always encourage all of our patients to kindly come and get help, some advice from us if you want to talk about the vaccination, if you're having doubts about having it, so that we can then kind of talk it through and encourage you to hopefully come and have the vaccination. I'm just having a little look if there's some questions coming through. Okay, so there are some questions here that might not be to do specifically with winter illness, but there's a question here about somebody wanting advice for leg cramps. Now, it's difficult for me to say in this forum kind of a blanket answer for leg cramps, purely because we need to take a bit more of a history. I would recommend that you would see your GP for a detailed history onto your particular symptoms, and we would need to do some tests before we can advise on what you would need to do for that. Okay. We're waiting for some more questions to come through. I think, so going back to the flu vaccinations, the vaccination period is still active. Just like to remind everybody that the last vaccinations are given until the 31st of March 2026 this year. So if you are interested in having a flu vaccination, you can contact your GP surgery, Connect Healthcare, or even your local pharmacy. Okay, yeah, there's a question here. Suffering from an autoimmune disease and it gets worse during the winter. Is there anything I can do to help? So now, one of the very important things to do when you have something like an autoimmune disease, what that does is it does make your immune system a bit weaker than the general population, because you might be on medications that would weaken your immune system a little bit as well. Therefore, if you are getting any flu-like symptoms that we have touched on earlier, please do seek some medical advice or even a face-to-face appointment for an examination to see what specifically is the problem at that time. Because if it's a chest symptom, is it a throat symptom, or is it a more generalized system? Because we always need to worry that untreated bacterial chest infections can make you very ill and that you end up in hospital. So I would recommend you seek medical advice sooner rather than later. Okay. While waiting for any other questions, we were talking about vaccinations. So I'd like to touch on COVID-19 as well. As I said, it's still in circulation within the UK. It is to a much lesser degree than it was in the pandemic. I think on the 7th of January, the current active COVID cases were at 611 in the UK, which is far, far less, but it is just to bear in mind that it is a virus and we don't need to test or isolate for it now. So, but if you think you may have COVID, as you know, as per your symptoms, you can get a test. And if you are worried, you can always ring your GP surgery or 111 for advice. And COVID boosters are also still available for the at-risk population, who are people over 75 years of age, children 6 months of age to 74 years of age with a weakened immune system, or anybody who lives in a care home. Okay, we have a few more questions here. Do we recommend nasal decongestant sprays? So now this is interesting because it's part of the over-the-counter remedies that are available for you if you are suffering with sinusitis type symptoms. If you've got a runny nose, you're getting congested, that's causing difficulty breathing, you can always see your local pharmacist who can take a history and recommend something. They will also check what medications you are on, and then they can do a safe recommendation. So I've got a question here about somebody having a chesty cough, and do you recommend antibiotics? Now, this is a really good question because we do have a lot of people coming in worrying about chest infections when they've got a chesty cough. Now, chesty coughs are common in this time of year because it is part of the flu-like illness that we will get with the influenza virus and most of the other viruses that are circulating. Now, just because you have a chesty cough does not mean you need antibiotics, and neither does it mean you need antibiotics if your phlegm turns color. Now, it's really important for you to look at self-care. This means making sure, firstly, that you are well hydrated. If you've got temperature symptoms, using paracetamol and ibuprofen if you're able to take that, plenty of rest, and look at the workplace environment you're in. If you're working from home, that's fine. You're able to take time out and rest your voice and sore throat symptoms and all of that. But if you're in a crowded open office type setting, you may want to take a day or two out of work to make sure that we are not spreading the virus, as we spoke about before, because it's one of the commonest reasons for viruses to spread. And if you're sneezing and things like that, always make sure that you're using a tissue, washing your hands. All that will prevent further spread. Now, coming to the antibiotics, we would never advise people to request antibiotics over the telephone, because it's always best practice from a clinician's point of view to examine the patient and assess whether you do genuinely need the antibiotics. Now, needing antibiotics don't depend on the duration of your illness. So some people may need antibiotics within 2 days of having a winter illness. Some people may have to go 2-3 weeks before the virus didn't clear fully. Then while their body was a little bit weak, a bacteria took over, and now they've got a few worsening symptoms that a clinician assesses them to need antibiotics. So I think in my practice over the years, I'm finding that people are more open to having that discussion with a clinician as long as we explain to the patient clearly why they don't need antibiotics, because we still have a proportion of patients coming in wanting antibiotics, especially for children, because parents and guardians worry that children will deteriorate sooner, and they want to get ahead of it, especially if they've got 2 or 3 children at home. So this is all understandable. And what we do is we always say, bring the child down. It's better for us to see them, and then we can have a very real face-to-face conversation with the parent about what are the reassuring factors in the child that we don't think they need antibiotics and what they need to look out for. Okay. So someone here says they've been told by the doctor they have a viral illness. How long should I wait before going back to see them? Now, realistically, viral illnesses vary in different people. Some people say, oh, I have a really great immune system. I only got ill for 2 days. And some people go, gosh, when I catch the cold, I don't get well for a couple of weeks. So again, it is up to you. Nobody knows your body better than you if you're an adult. And if you're a child, nobody knows the child better than the guardian, the mother, father, or the guardian that's seeing them every day. So if you think something is amiss, don't wait, because what we don't want is for you to end up being admitted to hospital, as we talked about the pressures on the hospital beds earlier. So it is better to get seen. And getting seen at a GP surgery, you will find that in Rotherham and all around the country, we have various different types of clinicians seeing you and who are fully qualified to assess winter illness. Now, these people, sometimes they may be a paramedic, they may be what you call an advanced nurse practitioner, and it may be a GP. And in some practices, there are also clinical nurse specialists who can see patients and prescribe. If any of these staff members have any queries or not sure what they're finding when they examine you, they will always get some advice or a second opinion from a GP within the building. So it's really important for you to assess yourself and see whether you think the viral illness is lingering longer than you would normally expect. Sorry, just waiting for the screen to come back on again for the next question. So, are there particular vitamin supplements that you feel would support people's immunity against common winter viruses at all? So we always tell people, eat healthy. Make sure you've got a good balanced diet, good fluid intake, taking vitamin D during the winter season, because we know we don't have enough sunlight. There's a big drive for people taking other kinds of vitamins as well. But basically, the bottom line is just keep yourself healthy. Make sure you're getting good activity. It doesn't always have to be vigorous activity. It could just mean going for a little walk around the block, just keeping yourself active. So there are no particular vitamins as such. I said the vitamin D, but other than that, just multivitamins and a good healthy diet helps. Okay, we got anybody else on here? How do you know if an illness you have is viral or if it needs antibiotics? I think we slightly covered this before. There's no way for you to know if it's viral or not. And sometimes when you go to see your GP or nurse, they don't know if it's viral or not. The difference is that they will take a good detailed history, ask you a lot of questions, then examine you, and then if they feel they need to take swabs from your ear, from your throat, or ask you to cough up a phlegm sample, they will do so. And the clinical judgment of how to manage you is born after that assessment. So that is based on them. There's no way, even for me, when a patient is sitting with me, to know if they're having a viral or bacterial illness without doing further tests. I would just base it on examining them and how they look in front of me. How long do I wait before coming to the doctors about cold symptoms? Now, having a cold in the winter season is one of the most commonest symptoms. You will find everybody's got clenched a few tissues in their hand in the supermarket, in the coffee shops, wherever you go, everyone's got tissues in the winter season. So a cold can linger. Again, if you've got young children, if you are looking after grandchildren, you are very likely to go from one cold to another. So you may find that that original cold never got better, but your immune system is doing what it needs to do to try to fight it, but a slightly different strain of the virus got in a few weeks later from the nursery, being exposed to the younger generations, and then you just caught a new cold, but you may not feel that way, so you find the cold lingers. And again, the bottom line is, if you are having difficulty breathing, if you are having chest tightness, you're coughing up phlegm, the phlegm ever has any blood in it, or you're finding that your ear is so painful that it is radiating or coming down into your jaw, you're feeling dizzy, headaches are getting worse, you're finding you can't turn your head, having difficulty driving, loads of symptoms that you wouldn't expect to see with just a normal cold and a cough. If at all you have any queries, there are, 111 has an advice line. Also, as I said, GP surgeries have advice lines. You can do text advice, telephone advice, and then also ask for face-to-face. You can get double checked. And then the easiest way otherwise is to just nip into your local pharmacy and try that as well. Now, one thing I will mention about Rotherham and the access during the winter season is there's high demand. Everywhere there's high demand to be seen because people are worried, especially when you're coming up to the Christmas season. We were having those 2 blocks of long bank holidays, and people just wanted to be seen to make sure they were not going to be unwell. So in Rotherham, we have what we call winter pressure clinics. So every GP surgery has access to extra appointments for their patients. Now, what this means to you is that you may have to travel to a site that is outside of your GP surgery. That may be in your local PCN, which is a cluster of GP surgeries that work together, or you may need to travel to a central site because it all also based on where room availability is. But we do try in Rotherham to try and keep these clinics to places where there are easy bus routes and parking and things like that. And there are what we call acute respiratory infection clinics, and they are just for people who've got flu-like symptoms. So you will have a quick checkup, quick bit of reassurance or antibiotics, or if you are really unwell, they will escalate it and send you into hospital. So that assessment, those clinics are available to all patients across Rotherham. Okay. How best to avoid or prevent norovirus? Just like any virus. So norovirus causes a diarrhea and vomiting-like illness in majority of patients who get it, may it be children or adults. So the best way to prevent it is if you've got norovirus, you need to stay off work for 48 hours after your diarrheal episode. And when you are having diarrhea and vomiting, it is about making sure if it's a shared bathroom, making sure you're using disinfectant, keeping everything clean, and self-hygiene. So viruses, as I said, they spread really easily. When it does, again, diarrhea and vomiting can put you at risk of dehydration if you are losing fluid from 2 ends. And if you are worried because you're feeling really weak, ask to be assessed. And that can be done over the telephone, but it's difficult to kind of do a dehydration assessment over the telephone. You may be sent to a face-to-face appointment, as I explained in one of the sites. Okay. So there's a question here saying, what equipment would you recommend people have at home, especially when looking after children? So this is a really good point. Now, all parents, we worry about our kids because they're little and they cannot explain to us what kind of symptoms they've got. So we are the ones that know them the best. And you look at your child and you go, oh, they're not very well. They're not as active. They are refusing their favorite meal. They're looking a bit flushed in the face. They're not weeing as much. All this, you worry about them. So one very important piece of equipment to have is a thermometer. So there's lots of kinds of thermometers out in the market there, but the best kind is the one that you put in the ear, because that gives you what we call a core temperature, as opposed to the ones that you use on the forehead or the ones you hold like a gun, which is less sensitive. They also give you an okay reading, but the best ones are the ones that you put in the ear, and these are available to buy on lots of online forums and also from your local chemist. And that is the only thing you need to really have at home for your child who is otherwise fit and well. There will be other equipment that you may be advised to have if your child has other more chronic illnesses like heart or lung conditions. You may be advised by Sheffield Teaching Hospitals or some tertiary hospital to have a pulse oximeter, which is a little clip where they put on their finger to monitor their oxygen levels if they have had issues with their lungs when they were newborns, so on and so forth. But for the general population, just a thermometer will suffice. Okay. Can you take ibuprofen and paracetamol together? If so, how do you recommend they are taken together or staggered? Okay, another really good question. Thank you for that. So it's really easy. When you come to see us, we say, oh, take ibuprofen and paracetamol. So if you are taking paracetamol, that is 4 times a day medication. So it's roughly every 6 hourly, and ibuprofen is 3 times a day with food. So not on an empty stomach, because we don't want to cause any irritation of your tummy. So in itself, say for example, you take your first dose at 8 o'clock in the morning you woke up and you were feeling unwell, automatically, from what I just said, it'll automatically stagger itself. because the paracetamol will be then, the next dose will be 6 hours later, and the ibuprofen will be 8 hours later. And then you go 6 hours after that for the paracetamol and 8 hours after that for the ibuprofen. And just from the way it is, it will automatically self-stagger itself. Now, another thing to remember is we don't expect people to keep alarms and wake up in the middle of the night to take their paracetamol and ibuprofen. So you don't always have to try and fit 4 doses of paracetamol in your waking hours. If you haven't felt the need to take it, or your temperature wasn't coming back, or you weren't feeling that lethargic and having that joint and muscle pains, you can just take 3 doses of paracetamol in your waking hours. And the same goes for ibuprofen. But it is okay to take your 3 or 4 doses in your waking hours, and it be a little bit shorter than the 6 or 8 hour interval. Would you recommend flu and cold reliefs such as Lemsip, etc.? So all these over-the-counter, flu and cold remedies are really helpful, and they work for some people, and for some people it doesn't work. They just give you a little bit of relief. Tickly cough medicines, we've got Lemsip, which has got antipyretic elements to it. That means medication to bring the temperature down and help you to get some sleep. Sometimes some of the medications decongest you, so therefore it gives you a little bit more relief again. So they do work some of the time, but if you feel that you've been using them for a long period of time and they haven't helped, again, please seek medical advice. Is having a temperature normal when having the flu? Yes. So most people have what we call a low-grade temperature. So it doesn't need to be spiking up and down, making you almost confused and not able to walk properly, making you dizzy. That is a red flag symptom, as we would call it, and you should seek advice if you were getting a really high temperature, which was associated with any of the symptoms I just talked about. But a low-grade temperature where you feel a bit listless, a bit lethargic, like you want to lay on the sofa all evening, that is normal, because your body is busy fighting the virus, even though you may feel, I've been resting for the past 3 days and I feel exhausted. So it's because your body is busy fighting. So it is doing what it needs to do, and because of that, your body will have run a low-grade temperature. And for that, you can use paracetamol and ibuprofen. Okay. So then we have, what can you do to prevent common cold going straight onto the chest? I cannot take ibuprofen due to having kidney problems and causing a chest infection. So again, there's no way to prevent a common cold going to your chest. Treat yourself as soon as you feel that you're starting with a cold. A common cold doesn't always go to your chest unless you've got pre-existing lung conditions. There are various types of lung conditions that cause the bugs in your upper airways to go into your lower airways. They could be things like asthma, COPD, bronchiectasis, lots of lung conditions that cause your immune system to be not as good as the general population, and therefore the common bugs can just go down. And if you are worried that they have gone and settled into your lungs, please again request a face-to-face appointment, and you can be directed to the appropriate place for that. Okay, there's no more questions at this point. So we were talking about vaccinations. I think I touched on COVID a little bit. Another vaccination we use and we recommend people having in the winter season, and to prevent pneumonias and meningitis leading into sepsis, which is when you get infection spilling into your blood system, is a vaccination called pneumococcal vaccination. Now, all babies in the UK vaccination program are given this. 3 of these vaccinations before they're 1, and adults over the age of 65 are given a dose. Now, if you have certain medical conditions, you will be invited to have a couple of these doses as an adult, and sometimes if your immune system is weakened due to medications, you may also be invited to have this vaccination more than once as an adult. Another vaccination that is being given in the winter season is the RSV vaccination. Now, this is being given, and all pregnant women are advised to have it. It is to prevent, to make sure the baby is protected when the baby is born. So from 28 weeks, as soon as possible for you to have this vaccination. And people aged 75 to 79, and anybody who turned 80 on the 1st of September 24, all will be invited through your GP surgeries to have this vaccination. So now the RSV virus, it is a virus that commonly affects babies, and it can cause serious illness in adults as well. And that's the reason to vaccinate the population about it. So common causes, what it causes, you can get a cold, a cough, and that can become pneumonia in adults, and a condition called bronchiolitis in younger children. Okay, let's have a quick little look here. It will be normal. What can you do to prevent a common cold? Yes, we've already done that one. Now, I'd like to talk about next the vulnerable sector of society that we need to look after as clinicians in the winter season. So if you're older than 65, have any chronic diseases, we would class you vulnerable to getting serious flu and want to make sure that you know how to seek advice sooner rather than later. Children under 5, low-income families because they may not have appropriate central heating and they're not all keeping warm. People with long-term conditions we spoke about, both they can be heart and lung conditions, they can also be autoimmune conditions and other chronic, any kind of chronic illness that needs you to take medication that can weaken your immune system. So you would be flagged up at your own GP practices as vulnerable, and you'll be invited for vaccinations and other health checks appropriately. So any people with disability, also pregnant women, as we told you, because we have to look after them for 2 people, and also people with mental health conditions. So all GP practices identify the vulnerable population, and we make sure that we are inviting them for vaccinations, making sure they understand how to seek help when needed, and what are the best ways that they can be seen when they do need to be seen. Okay, to end the chat about vaccinations, I think I mentioned this a little bit earlier, the flu vaccination does not cause the flu. It is a common preconception. I have patients refusing to have the flu jab. As I said, the flu jab will make sure you get a weaker strain of the flu when you get it and hopefully stop you from being admitted to hospital. Now, this doesn't mean that if you had the flu jab, you're definitely not going to end up in hospital, because I have patients who have had the flu jab and have had severe flu and have ended up in hospital. Now, these are very rare, and I must also add that they may have other medical conditions that complicate the situation. So therefore, it's always best to have a chat with your clinician one-to-one, because every case is very different, and then we can give you the necessary advice that is appropriate for you. Okay, any other questions? No other questions. Okay, so another common thing that patients come to see me during the winter season are children with rashes. So I thought it would be a good thing to talk about rashes in general, and especially in the winter season. Now, as everybody knows, a rash is when your skin goes a bit red, it can be bumpy, and sometimes they have blisters, sometimes they're flat, sometimes they're itchy, sometimes they're not, and sometimes they bleed, and so on and so forth. So if you are worried, it's always best to get the rash checked. Now, a clinician will assess the rash against the child. So how well is the child with the rash? And we take a detailed history about the rash. When did it come on, and the other symptoms that are associated with the rash. It's really important, because there are lots of rashes that if you have taken a child to the doctor, you may hear them say, oh, this is just a viral rash. So there is no way for us to say what virus is causing it, how long it's going to take to go away, what we do is we look for what we call red flag symptoms. Does the rash go away when you press on it? So you put a glass over your skin or the child's skin, and then when you look through the glass, the rash blanches, which means the rash goes away, so it becomes skin color, and then when you take the glass away, it fills back up to being red. So that is called blanching. Now that is a good sign. If a rash doesn't blanch, but the child is well in themselves, running around, playing, eating and drinking, you would make a GP appointment to be seen. But if they are unwell, they're like a bit of a rag doll, they're running a high temperature, the rash is spreading really fast, you need to either get the child seen ASAP. So that might be at the GP surgery or even A&E, because we worry it could be things like meningitis and something more serious. Okay, so another rash that we see commonly is a thing called scarlet fever that everybody knows about. So scarlet fever, children get a sore throat as well as a rash, and the rash feels very distinct. It's like sandpaper when you run your hand over it, but it's very small and red. So again, if you aren't sure, always make sure you get a clinician at a GP practice or one of these other clinics to see the child. Again, the urgency of that appointment will be decided by either a telephone call with a different clinician who will decide do they get seen on the same day, the next day, or a couple of days later. So they do ask a lot of questions about how are the children eating, drinking, wet nappies, or are they peeing okay? Is the rash spreading? How are they sleeping? All these questions we ask to assess how soon we see the child. Another common rash is called hand, foot, and mouth. You know, as it says, these are little blistering. It's a blistering rash in the hands, foot, and on the inner aspects of the mouth. Child gets a flu-like symptom. Again, it's a self-limiting viral illness. Very often you just control temperatures, keep the child well hydrated, eating and drinking. Again, it can spread. Adults also can get an adult variation of hand, foot, and mouth, which is very much a mild viral illness, but you don't need any medical treatment for it unless you were concerned about it or the child was deteriorating. And another one is slap cheek, that again most of you might have heard, where the children's cheeks go very red, they get a high temperature, might have sore throat and be quite not themselves. So again, very flu-like if you want to generalize it, but it is those very red cheeks that most people worry about. And if they are not drinking enough or not weeing enough, you would want them to be seen. Now, the only thing to bear in mind is if you have a young child who's got slap cheek and you are pregnant, you do yourself need to seek advice from your general practitioner, because we would need to do some tests on you as well. Okay. And chickenpox, it's not a winter illness, but it's a very common thing. Again, when we've got overcrowding and you can take one case of chickenpox in a nursery and that can spread as well. So to bear in mind, quite typical, but at the early stages, you can't distinguish it very clearly as chickenpox. So you may seek advice at that, from a clinician. That's okay. We have cellulitis, which is a skin infection. So if anybody gets a bite or a scratch and then it goes red and swollen in that area, you definitely need to seek medical advice. Children, when they're playing, they fall and they can get, superficial skin infections, which are not uncommon. Impetigo is another kind of skin infection rash, which is common again. They can have a little bit of a scratch on the face or something that goes quite yellow and crusty, and it keeps spreading. Children are not unwell with it, but you may want to seek help because it needs a prescription for some topical or oral antibiotics. Okay, let's have a look. Some questions are coming in. Norva, can cold or flu turn into pneumonia, and what are the symptoms? Yes, so of course cold and flu can turn into pneumonia. As I said, the initial flu-like illness is majority of the time an upper respiratory tract infection. You're bunged up, you've got a runny nose, you've got headache and all that. Pneumonia is when the infection moves further into your lungs. And because you've not been able to clear the virus yourself, you've been run down, bacteria can set in, and that then becomes a pneumonia that your immune system alone can't fight, and you need some antibiotics. And sometimes if you're really unwell with that, you may need to be admitted to hospital. So you ask what symptoms we are looking for. So one could have symptoms, not to include all of them, but there could be some of these symptoms: chesty cough, bringing up quite a lot of phlegm, or sometimes quite a rattly chest where you can't actually cough the phlegm up, getting chest tightness because your lungs could be full of the infection, causing it to feel quite tight as you're coughing, getting quite short of breath when you're trying to do simple things around the house, like climbing the stairs, which you were fine doing a month ago, and over the past few weeks things have gotten worse. If these symptoms happen, you should definitely ask for a face-to-face assessment by any one of the clinicians we talked about before. Now, what we call a red flag symptom, if you have these symptoms plus you're coughing up blood, you do need to be seen, because it's really difficult for us to say when you've got infection in your upper and lower respiratory tract, for us to know is the blood coming from the back of your throat by having a hacking, barking cough, or is the blood coming from lower down in your lungs because of other things going on. So it's very difficult to give generalized advice, but if any of these things happen, it's best to have a one-to-one assessment so that the medication can be tailored to what is found. Could you give a suggestion on how to deal with stuffy noses when being indoors a lot and drying out with the central heating, then going outside in the cold air and sneezing and having a blockage all day? Yeah, so this is one of the downsides of central heating, because it is very, very drying. So some people find that steam inhalation with some albus oil and things do just loosen up your airways and always blow out whatever you loosen up. And it doesn't help, because you may not know, but you may sleep with your mouth open, which again dries up your upper airways, which causes quite thick, sticky snot. And that will cause you to feel quite congested and uncomfortable. And then you end up feeling like something's dripping at the back of your throat after you've woken up a few hours later. Then you start coughing. That then causes you to be very uncomfortable and short of breath, so on and so forth. And it is all born from the fact that everything is getting quite dry. So again, making sure that you're drinking plenty orally, as well as some steam to try and decongest your sinuses and things if they are feeling quite congested. So somebody is asking about SAD and what support is available for SAD. Vitamin D dosage for depression. Okay, so SAD is seasonal affective disorder. I was going to touch on that, so thank you for that, bringing up that question. Now, this is a type of depression or bipolar disorder which causes low mood in the winter months. And this is because of the low levels of sunlight. Again, if you are a walker, jogger, some people don't go out and do their outdoor activities in these months because there is icy conditions, it's dark and things like that. So it gets them down. Now, the basis for SAD is that the chemicals in the brain, there are two chemicals, melatonin and serotonin in the brain. These are chemicals that we need to keep our emotions and well-being. They are reduced by the reduced daylight. And therefore, what happens is there's an imbalance of these chemicals by the reduced daylight. So it causes you not to feel great, and you can't bring yourself to function as normal. So you may find that it's affecting work, it's affecting your relationship, it's affecting your ability to do your day-to-day house chores. That in turn causes a negative feedback on, goodness, I've got all this to do that I should have done yesterday, I should have done last week. And then it all builds up into this kind of feeling really low, where you feel there's no way to come out of this rut that you're in. Now, it is 4 times commoner in women and affects about 1 to 3% of adults. And the typical age that it affects is 18 to 30-year-olds. So now, if you have a past history of having suffered depression, or there's a family history of depression or bipolar disorder, you may find that you do suffer with SAD. So as I said, you can have a low mood. You may find you're sleeping a lot because of the lack of exercise we talked about. You may find you're gaining weight, and that causes you to feel low in yourself. Because of all of this, you socially withdraw, and it tends to go around in a cycle, and you lose interest in the things that you were previously interested in doing. So therefore, this ends up being long drawn out for 3 to 4 months. and then you go and see the doctor going, I don't know what's going on. Most of the time they'll do tests, making sure your thyroid's okay and all that's all right. And if all of that is okay, your doctor might touch on the fact that you may have SAD. So there is no way to diagnose SAD. There's no test for it. So how we know this is, say for example, you've had very similar symptoms for 2 consecutive winters, where when the spring comes and the sun starts to shine and the daffodils start to come out, you start to feel completely better. That is the diagnosis of SAD. So if it happens for a couple of years running, then it may twig to you and to your doctor when you go 2 consecutive seasons. We go, right, this is what you probably have. Now, the treatment for it is we can use SSRIs, which are a form of antidepressant medication, which you don't have to take all year round. You can take it when you're going into winter. So in autumn time, if you know that your SAD is really bad and you can't manage it yourself, you may want to go on this medication, because lots of people don't go on the medication and they use white light for 30 minutes a day first thing in the morning, and it seems to help. There's also CBT, which is cognitive behavioral therapy, where if you have your chat with your GP or your local service, they can direct you to how you get some CBT for it. It is about what you do to deal with the feelings when you're getting the feelings. So cognitive behavioral therapy, you understand what's going on and you change your behavior to be able to overcome that. So that is a form of therapy that you may need to learn the behavior over a course of a 6-week period that you can then continue to apply seasonally. Okay. And then part of that question was also talking about vitamin D dosing. So there is no vitamin D dosing for depression, but vitamin D, I think I touched upon it earlier on today about taking vitamin D in the winter season because there is lack of sunlight. So we're all indoors. A majority of us work. When you go to work, you leave in darkness, sun hasn't fully risen. You come back home when the sun is setting or after the sun has set. We have very little time to actually sit outside, because ideally we need to be bare below the elbows and knees for 30 minutes every day in direct sunlight to get the amount of vitamin D our bones need and our body needs, which we couldn't really do, especially not in the winter because it's too cold. So the standard dosing of daily vitamin D, you can speak to the pharmacists about that as well. It's very easily bought over the counter. It's 800 to 1,000 international units, and they normally come in a 1 little easy to swallow capsule. So that is a recommendation, unless you have very low vitamin D that your GP might have tested and found out, where you will find that you need a 6-week course of high dose replacement, which is prescribed by the GP if it is needed. And after that, you do need to continue to buy the vitamin D supplement yourself for the rest of your life if you have been found to have low vitamin D. Okay. Next question. Thanks for the answers. If I want to make a family soup that warms us up because body feels afraid, sensitive to the cold, what would you suggest? Okay, I am not a cook, unfortunately. Even though I do like to cook, I couldn't come up with a soup recipe just on the spot like that. Let's have a little look. So I have been taking large doses of vitamin D and my mood greatly changed, as well as my back stopped hurting. Okay, well, that's great. Just make sure you're not overdosing yourself on the amount of vitamin D that you're taking, because vitamin D can also be toxic. So just make sure that you have spoken to a clinician about it and you are taking a safe dose. Okay, everyone at work seems to be ill. How do I avoid catching it? Now, we still have people, if they're working in open offices and a lot of your colleagues have coughs and colds, you can choose to wear a mask yourself. Or if somebody feels that they are coughing or sneezing quite a lot, they themselves can wear a mask. So that's one way. Or just hygiene, making sure that you wash your hands, sneezing into tissues, throwing it away and things like that. There's no other way, unfortunately, to stop yourself from getting ill apart from, keeping healthy, as I said, eating well, hydration and all of that. Okay, oops. That screen went off. I'm so sorry. Give me 1 second. technology. It's very sensitive. Okay, so suffer really badly with restless leg syndrome, always feels worse during the winter. What would you recommend? So restless leg syndrome, it's like every joint and muscle aches are worse in the cold because you do feel stiff. Now, I don't know what has been tried for you for your restless legs by your GP. It is not, it is just commonly known that it will feel worse in the winter because joints are stiffer, muscles are stiffer. So what I would say is I don't have a recommendation for you now, but I would recommend you seeing the doctor about it. So there are free flu jabs available at Broom Lane on Saturdays from 10 to 6. So if there is anybody who wants a flu jab, you can walk into an appointment, I've been told, in Rotherham at Broom Lane Medical Centre from 10 a.m. to 6 p.m. How do we avoid winter illnesses if you have asthma and prone to chesty coughs? Again, this is exactly what we said before. You can avoid illness by not going out anywhere. So because you can catch it, it's a virus, it's airborne, you can catch it, but just keeping yourself healthy, making sure you're taking vitamins, eating, your multivitamin if you are, eating healthy. If you are asthmatic, use your inhalers. If you start with any flu-like illness, self-care first. If you feel it's going onto your chest, get assessed sooner rather than later. Make sure that you're just wearing a mask if you're working in a crowded office. You can wear a mask if you're going in public transport, into crowded environments in an evening and things like that. Unfortunately, there's no way to avoid what's airborne in the winter. Okay, flu jabs. How much water do I need to drink before a blood test taken first thing in the morning to stop clotting? Okay, so again, we recommend people drinking. That's not a winter illness type of question, but let me try and answer that for you. We recommend you drink about 2.5 liters of water, liquids a day. If you're having a clotting test for a particular clotting disorder, that would be based on whatever the doctor recommended for you. There is, the amount of water you're drinking is not going to have an effect on the clotting factor result. Okay. Please, can you let me know about the irregular menstrual cycle? Okay, oops. Don't think we have any more questions there. Sorry about this, looking at a few screens at the same time. Yeah, did I do that there? There's a question about the RSV vaccine being new. Yes, it has been newly brought in. You would have found that people who qualify for the RSV vaccine has been invited to have it by your GP surgery. I talked about the common cold going to the chest, feeling worse at night. Yeah, I think we've answered the questions so far. Is there any other questions? Let me have a quick look. No, I think we're up to date with all the questions. Just trying to think whether any other messages I wanted to get across to everybody. So if there's a lot of information on the gov.uk website, Age UK, Asthma and Lung UK. There's lots of information. If you were worried about any symptoms, you want general advice, there's also gov.uk. There's Healthier Together, another website. Lots of information there for you to kind of go through. Or even prevention is basically better than cure, as we always say, for everything. So you've asked several times, how can we prevent getting a winter illness? Just by staying safe, mask wearing, staying vigilant. If you've got family members who have got coughs and colds and you've got a bad lung, just not hugging and kissing them when they are ill, just to make, kind of minimize the contact to make sure that they're not able to transmit that virus easily to you. And I think that's all the information I have for you guys today about winter illness. Just checking the screens one more time. That's all the questions for this evening. So thank you very much for joining us. I hope it has spread some light into dealing with winter illness. So the key messages I think today are making sure that when you have the simple winter coughs and colds, self-care, get advice from your pharmacy, call 111, look on the gov.uk and NHS websites for any advice if you can't, if you haven't been able to get that from the pharmacy. If at all you're concerned, please ring your GP practice or 111. They can both make appointments available for you. The thing to remember is that your appointments may not always be at your own GP practice for reasons explained. We are having to increase our capacity because of the demand to be seen, and therefore you may have to travel a bit locally, and bear in mind that we will deal with the symptoms appropriately when you are seen. So thank you very much for your time this evening.